Doctors of Reddit, what was your dumbest, r/I am very smart, patient experience? Part 2. RN here. I see some crazy stuff, but one thing that stands out was the time I was admitting a guy to the hospital. I can't really remember what for, but he was about 400 pounds, diabetic, heart disease, you name it. Anyhow, I'm at the computer going over some admission questions with him, and his 10 family members, who were crowded in the room with him. A few minutes in, he starts complaining that he's thirsty. He needs something to drink right now. So, I get on my phone, and call the nurse assistant, and ask her to bring in some ice water. As soon as the words are out of my mouth, the whole family screams, "No! No water! He is allergic to water!" Well, this is gonna be a problem. Turns out, the guy had been drinking nothing but Sprite and sweet tea, for years, because of his water allergy. The next question the wife had was, where are we all supposed to sleep? The whole family, 10 people, were planning to stay at the hospital with him. You can't make this shit up. Anytime a patient comes in, who is deathly ill, and clearly needs antibiotic, or cholesterol, or blood pressure, or etc. meds, to get better, they tell me, I'm not taking the medicine. I know you just prescribed those, because the drug companies pay you. Yes, sir or lady. All of these drug companies are giving me dollar bills y'all, to put you on an antibiotic, or cholesterol, or blood pressure medicine, etc. Right. My aunt, who has varicose veins, pretty obvious to anyone who sees it, once asked me why her legs hurt, and what those bluish lines under her skin were. I almost went on to explain to her about dilated veins, when she interrupts and decides for herself that those are her nerves. Dying nerves. And the blue stuff was blood clots inside the nerves. I'm a med student. I was doing a respiratory system examination on this guy, who frequently, about once a month, gets admitted in the general ward with complaints of breathlessness. He's had COPD for a couple of years. Quite bad. And he tells me that he isn't going to quit smoking, because God told him not to. When asked why, he tells me that the people who are relying on him for their daily livelihood won't survive if he stopped. I went on to ask him if he meant the people at the cigarette factory, or the health industry. He didn't get the sarcasm, though. Patient comes to the surgery clinic with complaints of mass per rectum. Now, I wasn't there the first time he came. But the surgeon wanted to do a couple of investigations, and advised him to get admitted. The guy decided he doesn't want to. Couple of months later, he comes back to the clinic. Apparently, he went to one of these alternative medicine places, or whatever, and they had tied this metal wire, not exactly sure why, around the mass. By then, this mass has eroded through it, and was bleeding, and had gotten much bigger. Turned out to be a cancerous growth. Not an MD, I'm an RN, that works with oncology, cancer patients, some of which are on clinical trials. I got a patient and, before starting his chemotherapy, reviewed some of his lab work with him. I told him his glucose level was 73. Normal range is usually between 70 to 100. He got really upset at this point, and asked him, "What's wrong? Your labs are within range." And he said, "I need it to be 0. I said, "What? Why would you want your glucose to be 0? He said, he's trying to meet requirements for a new clinical trial that requires his glucose to be 0. I told him, I don't know what clinical trial you're trying to get into, but if your blood glucose was 0, you'd be dead, or dying. He was not convinced, because I'm just a nurse, so I sent a message to his MD, asking them to educate their patients better. Dr. Gross eyeball stories, from my doctor. I recently had a 30-year-old, insulin-dependent male, argue he knows when to take his sugar medicine. He had bilateral retinopathy, and a severe vitreous heme in one eye. Legally blind. Driving a car, last I checked 8 years ago, lost glasses 2 years ago. Will need 4 or more surgeries, including an inevitable cataract. I had a patient tell me they clean their contact lens with milk, because it gets the acid off them. I had a patient ask me if it was okay to look briefly at the sun, for short periods of time, to improve their eyes. I was amazed, and kindly suggested they don't. Had a patient put eardrops in one eye. White part of eye, conjunctiva, scarred over entire cornea, and was left with no light perception. Asked me if he should have come in sooner. It had been 4 months. He needs a cornea transplant, which suck ass, and take over a year to recover from. Patient with a retinal detachment told me to put more medicine in their glasses to see better. Macula was off, so they could barely count fingers, 4 feet in front of face. Had a patient wear contacts designed for 2-week daily wear, leave-in, for 8 months. They literally grew into and became a part of eye. It was repulsive. Had a patient with a 6-year-old translating. Basically no clue, besides, eye hurts. Her hand covering her eye. I asked to see the problem. Her eye looked like a shriveled up grape. The optic nerve was holding onto a shriveled up decayed eye, loosely hanging in the orbit. She wanted glasses. Had a lady put jock itch in her eye to cure her suspected fungus. I asked her why she thought it was a fungal infection, and she just had an inkling. They are rare. Cataracts on a 58-year-old male, working rooftops for 30 years, with no sunglasses. Best corrected vision was, count fingers 6 feet 1 eye, barely seeing better another. First eye exam. Mad when I told he needs surgery and should not drive a car. Had a patient tell me the benefits of using alcohol wipes to clean her ass and vagina. Out of the blue. I'm an eye doctor. Had a guy clean his contacts in shower with shampoo because he was convinced it was better. Raging red eye, 2 weeks later. Homemade contact solutions are always fun to hear. Vinegar? Salt water? Spit is not cleaner than fresh solution. But please, tell me more. Had a guy recently come in because wife me made. Tried with the tweezers to remove metal from cornea. Didn't look pretty. I removed the remaining metal rust with a needle and spinning burr tip brush. Antibiotics Q 2 hours. Told him not to do that again. Had a patient crush a pill up and put in eyes. It was an eye vitamin, but taken by mouth. Her eyes were angry. I had a patient walk in one day, no glasses or contacts. Had full penetrating cornea transplant both eyes 17 years ago. Last eye exam was 12 years ago. Swore he could see fine. Clearly a transplant graft rejection one eye, with no functional vision, and other was gnarly looking good, eye. I barely got him seeing with glasses on the one eye and can't drive. Uncontrolled diabetes too. Messy. Have had more patient argue with me about not seeing right. They either had 2 or more contacts in eyes, or none at all. When they try to remove a contact that is not there, it causes a painful abrasion. Multiple women using non-approved glues to glue on fake eyelashes. Leaks and burns in eyes. Just why? Using fake contacts from the nail salon. Then it never ceases to amaze me when I hear, I just use the same solution until it turns brown or black. Every day. Had a patient using a homeopathic drop to cure itchy eyes. She had pubic lice living on her lashes, and they lay eggs and bite. Repulsive. But still convinced the drops cause the lice. You pluck the offending lashes out, and use a cream to kill the crap you can't see. Thank God, that was only once. I have to convince a lot people to not use hand sanitizer in their eyes. Way too many, actually. I had a patient not taking her herpetic eye drops because she just wanted to pray instead. Yes, herpes on eye. Luckily, I convinced her to do both, medicine and pray. I could go on and on. Any variation of this, which I get all the freaking time. Me, so, how are things going with your diabetes? Them, I don't have diabetes. Me, them, why are you taking metformin or Victoza or whatever? Them, I used to have diabetes. Then replace diabetes with hypertension or antihypertensive, etc. Or when I ask them what medical diagnosis they have, and they say none, while taking a ton of meds. Or when they misname a body part. Prostrate, tendon, uterus. To name a few. I work in the ER. We had a very pregnant patient come in, needing stitches in her vagina. Turns out, she was a realtor, and didn't want her water to break while she was showing a house, so she put a glass cup in her pants to catch the water. Instead of using a pad or an adult diaper, she went for a glass cup. She sat down while showing a house, and sure enough, it broke and cut her up pretty bad. Obligatory, not a doctor, but I am a medic. Back when the Ebola crisis was huge, and media was losing their shit over it, I had a very interesting call. There are definitely other I am very smart instances, but this was at the forefront of my mind, and it makes me both laugh and cringe at the same time. We were riding 3 deep, all-female crew. Dispatched to a sketchy part of town in a bad apartment complex, for unknown urine problems. Okay. I'm taking the back seat on this one, kinda, just going to observe. We're met at the ambulance, by a late 50s, early 60s African-American male. Unkempt, yellow eyes, clothes that look like they've been slept in for a week, dirty nails, general uncleanliness. He asked us in a very thick accent where the men were. There are no men, it's just us. We all have the same training. If you're more comfortable with a man, we can get a male crew here, but they won't do anything different than we will. Women can't be in male positions. You should all be home, taking care of your husbands and children. Sigh. One of these people. I respect and get cultural differences, but sheesh. It gets old. After going back and forth, for a few minutes, about our training, and trying to explain to him, in futility, that none of us, at the time, were married, or had kids, we finally tell him, look. We aren't here to discuss us. We are here to help you. You called us. What made you hurt so bad, to call 911? We have to assess you. We can't just get another crew over here, not knowing what the problem is. What issue are you having? My penis. I think I have Ebola. Cue the eye rolls. You have Ebola in your penis, I said. It wasn't a question. Yes. I just came back from Liberia last week, and I haven't urinated in 4 days. Cue him spewing all tons of what his culture says about illness and Ebola. His cousin, who was a doctor in Africa, told him he had it, and it could be cured by banging a virgin, and eyeing all of us like we're meat. What the F? We wound up ignoring him and continuing our assessment. He was so adamant about it though. Cited obviously fake odds and facts, and bragged he had sex with several women in Liberia, and that's how he got Ebola. Okay. Are you in pain? Can we take a look? He let us get a set of vitals, but then he pulled his pants down. Conveniently forgetting his request for men, and apparently the fact all of us knew nothing, and should be taking care of our husbands, or whatever. His balls were the size of grapefruits, his pecker was turtled, to the point, it was basically inverted. His bladder was palpable and swollen, too. So, the dude was legit, he definitely had some issues going on. He was convinced he had Ebola. Only in his penis. Also, I'm sure, he was more shocked that we weren't fawning over his gross-looking genitalia, us being a crew of women. I should note, this dude, very much so, did not have Ebola at all. We took him to the hospital, and when we told the receiving nurse what the chief complaint was, she brought the doctor over and asked us to tell him to his face what the patient was complaining about. Ebola. When we went back dropping off another patient, we asked how patient 0 was. They laughed and said he just had some prolapsed organs in his balls, and his pelvic floor was trashed. Had to stick a catheter down his urethra to drain the pee. No Ebola, but he definitely was riddled with STDs. I don't know if this classifies as I am very smart material, but I thought it was relevant. Virgin sacrifices, to help, your stank D. Was working at a clinic. I was speaking with a non-controlled diabetic patient about her sugar intake, and she said she drinks a 32 ounces soda every day. I ask her if it's regular or diet, and she replies with, it's half regular. I let the ice melt first, so there isn't as much sugar in it. Sorry, but that isn't how it works. I have had several arguments with diabetics about Coke, or Kool-Aid, or sweet tea, versus those made with artificial sugar. I tell them, look, don't drink sugar. If you have to have something like that, use an artificial sweetener. No way. That stuff is poison. It will kill me. Ma'am, your A1C is 14. Sugar is already killing you. Most of my own stories go along similar lines too. Patient has chest pain, driving a coach load of school children, thinks it's indigestion, swigs bottle of Gaviscon, later diagnosed with a huge heart attack. My favorite ever story from a colleague, a patient comes into A&E with abdominal pain. As part of the workup, he gets an abdominal X-ray, which shows the problem, as clear as day. The colleague has then proceeded to remove, from the patient's rectum, an 8-inch replica of Nelson's column, the statue, in the center of Trafalgar Square, London. On showing it to the patient, the response was, oh, that's Nelson, he lives up there. I have one. I got this from my friend, who is a doctor on the children's ward, in a rural hospital. These parents bring in their child, whose hair is infested with lice. The lice was visible to the naked eye, and could be seen crawling on the child's clothing. While the medical staff examined the child, in order to determine a course of action, they discovered the child was covered in a white powder, and smelled heavily of chemicals. They asked the parents, what were the substances and the smells emanating from the child. The parents said, quite matter of fact, it was 7 powder, and flea and tick spray, they used on their dogs on the family's farm. Needless to say, social workers were notified about this case. Had a neighbor in rural Tennessee, who was convinced that the best way to treat her child's head lice was to comb diesel fuel through it. And that doing it, in an enclosed living room, while smoking cigarettes, was acceptable. She was baffled when CPS took her kid away. Nurse here. The number of American 20-something males who don't know what circumcision is ridiculously high. They think that boys are born circumcised. Evidence: new fathers and mothers asking me, what's wrong with their newborn son's penis? He still has his foreskin. Many parents choose to have it removed when the baby is a couple days old. It's called circumcision, often followed by a parent's question, what's circumcision? That's when I facepalm. Dead serious. We talked about circumcision in my grade 6 health class, but sans any pictures. I had absolutely no idea until I was in high school. I knew what it was, but had nothing to compare it to. This was pre-Google. A friend of mine is on her last year of her medicine career. She told us about a group of women they received, a very low social position, had gotten pregnant, and wanted to abort. Bear in mind, this is not the US, there are no abortion laws here. Well, they somehow heard of this method, where you make a paste out of smashed parsley, and put it in your vajayjay, to abort. As it turns out, it actually works, but because parsley has this enzyme, forgot the name, I think the substance is of Sorallin's family? That mixed with other stuff, causes severe cellular death and necrosis. Some died out of a necrotic woo-ah, some turned into a real-life Barbie, and not in a good way. I had a patient who was a completely non-compliant diabetic, smoker, morbidly, who had his first heart attack at 45. His blood pressure was also super high. And instead of taking his antihypertensive medications, he went to the gym. In the gym, he would sit in the sauna for a very long time, and sweat a lot, and lower his blood pressure by becoming dehydrated. During my rotation at pediatrics, we had an unconscious 16-year-old male with a prior history of type 2 diabetes. The mother had come home from work and found him acting strange, with slurred speech and stumbling around, so she immediately drove him to the hospital, where he passed out in the car. Running the full rainbow for blood draws and tests, the kid had a blood glucose of 285 and a BAC of 0.11 near. As we can guess, the kid was drinking after school, while his parents were away, got too drunk, didn't know that alcohol turns into sugar, and wound up drunk and unconscious, from both the alcohol and the lack of insulin. Not a doctor, but a gastro nurse. We had a recurring patient, who was just a really very strange lady. She had a stoma that absolutely stunk to high heavens, because the last 20 years, she has not been cleaning it properly. Every single day, her stoma would come off, because she was twisting the drain tube, and wouldn't allow us to change it. So, this lady was really rude, and would shout at us, too, and one night shift I couldn't take it anymore, and I snapped at her. I didn't yell, but I was overly stern about the fact that if she did not let me clean and treat her stoma, then the MRSA that she wasn't able to get rid of, because she refused high scrub washes, would eat her alive. In hindsight, I didn't handle that very well, but she let me change the stoma. So, this entire ordeal, she's yelling at me that her stoma bags are not cut to fit her stoma, that they are too small because her stoma is 50 centimeters by 50 centimeters, to which I corrected her, saying, that's impossible. She was adamant, that's how big her stoma was, it was a 30 millimeters diameter. When I was cleaning the stoma, she yelled at me, because it was hurting, so she wanted to just pop the new one on. I explained, it was hurting because of infection, as she never cleans it. She proceeds to tell me that she knows better, because she has had the stoma for nearly as long as I've been alive. I eventually ended up telling her to shut up and let me do my job, which seemed to work, and the stoma did not come off again that shift. When she was eventually discharged, she refused every placement, to the point where we almost considered a court order to evict her. One of our F1s nearly cried with relief. Not my story, rather my colleague's. A patient was admitted for anemia, and a localized cancer was found. She was referred to surgery, so she can get cured from her localized cancer, and she started telling everyone that it was the doctors who caused the cancer, and that she was doing just fine before coming to the hospital. She lectured the surgeon and my colleague, who pleaded her to get her surgery, so that the cancer doesn't advance, and yet she refused, saying she knew better, and probably didn't even have cancer. Not a doctor, I'm an optician, and at this point, I was a young lady in my mid-20s. I had a guy come in, saying he was a doctor, and he wrote himself an RX for glasses, and he brought frames. A few days later, his lenses come back, he puts on his glasses, and he can't see. I start going through the possibilities. Usually with progressive lenses, it's an adjustment issue, and they need to sit differently on his face. He completely refuses to let me adjust them. So, I check the lenses, and the RX match what he wrote. I try to explain that there's only two options, either they need to sit differently on his face, or the RX isn't good. He tells me, "You don't understand. I've had eye surgery for a disease that you've never even heard of." I offer to remake his lenses, to prove a point. His new lenses come in a few days later. An older co-worker is helping him. I told her everything. Again, he can't see. She tells him, "The young girl who tried to help you last time was trying to explain that if we adjust your glasses, you might be able to see out of them. Will you please let me try?" He lets her, and suddenly he can see, granted not perfectly, because he wrote his own RX, and the bottom sentence will explain more. Turns out, F.W.A.D. was a lung doctor, and not even an eye doctor. Was treating cavities on a very nervous 4-year-old. Had finally gotten into a cooperative groove, when Genius Mother looked up from her phone, and noticed that I was drilling teeth. She was in the room the whole time. I had reviewed treatment with her. She knew we were fixing cavities. Proceeds to curse me out under her breath, saying, "You're drilling holes in her teeth. This is effing ridiculous. You people are scammers, making holes in people's teeth." I kept my calm and said, "Ma'am, if you have questions, I will be happy to answer after I'm finished." I'm shaking with rage at this point, because she was 20 minutes late to her appointment, and I'm bending over backwards to make sure her kid has a good visit and doesn't end up scared of the dentist. Appointment is over, kid jumps down, high fives, and gives me a big hug, and I turn to mom and ask her how exactly she thought cavities were fixed. She said, "You don't drill. My mother is a dental assistant." I then proceeded to explain, in excruciating detail, the scientific process of how we remove decay. She said, "That's not true." I then told her that she can go ask her mom, ask Google, or go to dental school if she wants to know more, but I won't be treating her child anymore. Effing nutbag.